So we have talked about this stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, stratum basal. And after that, we see the dermoepidermal junction, DEJ, dermoepidermal junction. Yeah. So this DEJ, we are able to see the stratum basal. Then we had a mnemonic that come, let's get some bread. Come, let's get some bread. This is the mnemonic which we said. Come, let's get some bread. Okay. So this is what we remember from our previous discussion. And we said in the previous discussion that to say it loudly, have to say it loudly because you people are sleeping. So K514 heterodimer actually is present in stratum basal, while as K818 is present in liver, isn't it? Now, if someone is having a defective Ka10, if someone is having a defective Ka10, he will have liver cirrhosis. And if a person is having, I told you 312, K312, this is present in the cornea. And if it is defective, we say that person will have corneal dystrophy. Corneal dystrophy. Easy. And we said we have K15, and if K15, sorry, K14, it's not 15, K514, K514, if K514 is defective, it will lead to epidermolysis bullosa complex, epidermolysis bullosa complex. Now we said that we have melanocytes in skin. We have melanocytes in skin. These melanocytes are present in, so can you appreciate the cells? Now these melanocytes are actually, dendritic type of cells. They are present in the basal. They are present in the basal, stratum basal. Okay, easy. What these melanocytes are producing, they are producing melanosomes. They are producing melanosomes. What are melanosomes? They are what do they contain inside? They contain melanin. They contain melanin. Your skin pigment, your eye pigment, isn't it? And these melanocytes are getting transferred to your, they are synthesizing these melanocyte, and you want the color of the skin, the total skin, so they are getting transferred to keratinocytes. Now tell me one thing, should they have a channel type of a thing so that they can send them, dendritic type of a thing? Not from this side. Should they have this dendritic type of a thing to send the melanin, to send these melanosomes, not actually melanin, please remember, melanosomes. We have to send these melanosomes, like a factory, isn't it? We have to send it to the top. So that is done by our dendrites. Keratinocytes have dendrites. Okay. So remember, melanocytes will be in contact with the keratinocytes. See the keratinocytes via these dendrites. Via these dendrites. So this is how they will be able to transfer the melanosomes. Okay. We have a concept that is known as epidermal melanin unit. Epidermal melanin unit. Sir, what is epidermal melanin unit or EMU? 36 keratinocytes, 36 keratinocytes or 36 melanocytes. They form one EMU. They form one EMU. Sir, what is the function of EMU? It gives uniformity to skin texture. What is the function of EMU? It gives uniformity to skin color or texture. Now, according to the number of melanosomes, according to the distribution of melanosomes, according to the size of melanosomes, according to the content of eumelanin, pheomelanin, we divide people in different shades. We divide people in differentiate. I hope that from the biochemistry, you know how we synthesize. I want to integrate a biochemistry part here, if you allow me to. Okay, friends, can I integrate the biochemistry? Okay, let me integrate. So you have a tyrosine. You are actually starting your melanin synthesis from tyrosine. Now tyrosine will be acted upon by the enzyme tyrosinase. You will have an enzyme tyrosinase and you will form dopa. You will form dopa. A dopa or dopaquine. Dopaquine, not queen actually, quinone. So we have two substances now, two types of dopaquinones. So we have dopachrome and we have what was the name? Cystenyl dopa. Cystenyl dopa. Okay. So dopachrome will produce what? Eumelanin. U means true, isn't it? U means true. U means true. U means true. This is called true melanin. And if you are black in color or if you are brown in color, you will have more eumelanin. If you are from a south, from India or some from Pakistan or some the people which are more dark in color, they will have more amount of eumelanin. They have more amount of eumelanin. Now this cystenyl dopa is actually producing what? Pheomelanin. Pheomelanin. Pheo means pheo means phe, false. False melanin. That means you will be more red like Europeans. So red or yellow. Are we able to understand? So eumelanin, U means true and pheo means false. Pheo means false. So the false melanin gives you red color, that is brown color. Okay. Uh, Actually, there was a scientist. He's actually the father of dermatology. His name is Thomas B. Fitzpatrick. What? Thomas B. Fitzpatrick. Thomas B. Fitzpatrick gave a classification of skin. I want to teach you here, integrated. So he gave us a classification of skin. No, 6 types of skin. He gave us a classification that is 6 types of skin. Okay. So he gave 6 types. Okay. Type 1, type 2, type 3, type 4, type 5, type 6. Okay. No need to go into the scoring and something. Just remember 6 types of for your first year level. We have 6 types of, he said 6 types of skin. He actually said that why he classified it on the basis of skin. He said, some people have more propensity to get sunburns, or some people have more property, their skin is like that their skin becomes tan. Okay, tanning of skin. Okay, now tell me one thing, can you see them red? Okay, no. So they will they be having more pheomelanin or eumelanin? Will they be having more pheomelanin or eumelanin? They will be having more pheomelanin. They will be having more pheomelanin. And this group, black, will he be having more melanin or more eumelanin? He will be having more eumelanin. Very nice. Very good. Okay. So how we remember, how I remember them is type 1. Type 1 never tan, always burns. So people with type 1 skin will not get tan, or not tan, but always burns. But if I take this type 6, now bring this hair and this hair, always tan, never burns. Always tan, never burns. Okay, this is how we remember. Okay, is it easy or not? It's easy, interesting also, isn't it? So this is how we remember the skin types of this melanin. Okay, Type 1 never tan because we know that type 1 has more pheomelanin. Pheo means false. Pheo means false. That's why always burns. And black U means true. That means never burns. Definitely it will never burn. Melanin is there. This is a vitiligo. Don't go into this nodule, okay? Just have to appreciate the skin. Okay. So okay, now right. So sixth. So now see, look at me. Please look at me. So if I talk about this vitiligo a little bit, what do we see? What can we appreciate in this vitiligo? In vitiligo, there are irregular patches, isn't it? Aren't there irregular patches? So vitiligo, they have irregular patches. They have irregular patches with complete depigmentation. With complete depigmentation. What is happening? Why this happened? Because their melanocytes have been destroyed. Vitiligo is an autoimmune condition. Vitiligo is an autoimmune condition. So what is happening in the vitiligo is your autoantibodies are getting, they are against your skin melanocytes, and these melanocytes are destroyed, due to which melanocytes can't produce melanin and they can't give you a very nice eumelanin. So that's why she's having, this is a female I think, so that's why she's having a these irregular patches of complete this. Okay. So there can be also some other autoimmune disorders which this female should be having, okay, because it has associations. Pregnant lady, okay, this pigmentation disorder. So this is called melasma. This is actually a physiological what? Pregnancy changes. So physiological change in pregnancy. So a physiological change in pregnancy, this is called chloasma also. Cholasma. So what is happening is this is a hyperpigmentation. This is a hyperpigmentation. Hyperpigmentation. This is also called mask of pregnancy. This is called mask of pregnancy. Either it will happen in pregnancy or if a female is using oral contraceptive pills. So OCP or oral contraceptive pills or pregnancy. Okay. Now if female is more, now I don't think she's a a dark skinned female. She's I think from a pheomelanin category. So the female who would be more darker in color will get more. For example, this girl, if she gets pregnant, she will have more deeper, more hyper pigmented melasma. Okay, while as compared to this. Okay. Next, we may have seen the albino, this cute girl. So this is albinism. What is happening in albinism is the melanocyte is normal. There is a normal melanocyte. Melanocyte, there is no problem. The number of melanocyte is normal. May write like this. But melanin is getting less. There is decreased production of melanin. Why? Because we said, sir, already. Where is the biochemical reaction we said? This is tyrosinase. So you were using this enzyme to produce what? Melanin. Pheo or you? That was a different question. So tyrosinase, if the tyrosinase is less active, if tyrosinase is less active, so you will be having, or you have, tyrosine is not getting inside the cell. There is a defective tyrosine transport mechanism that will lead to, so will the albino, will they have increased risk of carcinoma or not? Skin cancers. Yeah, they will have increased risk of skin cancers. Okay. Are we able to understand? Guys, what's up? Okay. So this was all about this melanocyte. You will be reading more in the dermatology. It's not the part of your histology, but just I gave an association how interesting it is, how one cell can make a difference on your color and face. Okay, so this is how this one cell is doing. So we should now talk about, so what cells are present in the basal layer. So we have, where is the basal cell layer? So let us write like this. So what cells are present in the basal layer? We have basal cells. So we have, what cells we have here? We have melanocytes. They are producing what? Melanin. We have also some stem cells. We have also some stem cells. Okay. We have Merkel cell. A Merkel cell. What is Merkel cell doing? Your light touch. You know, light touch. You have receptors for light touch. So light touch sensation, you know, fine touch sensation, that is done by Merkel cells. Okay, these Merkel cells in the basal layer. Okay, we had also drawn the basal layer last time. Yeah, yeah. Okay. So did we saw the Langerhans cells last time? Langerhans cells. Where are the Langerhans cells? So we have also some Langerhans cells. They are present in the just below the, you know, that in the epidermis, no, below the granular layer we had seen. I hope there is the image. It's not here. So let us write like this. So Langerhans cells we have in the, so Langerhans cells were like this, you know, they have extensions like this. So Langerhans cells, what they have? Langerhans cells are present in your, can write upper regions, okay? So they are actually, what Langerhans cells are? Your antigen presenting cells. Your Langerhans cells are antigen presenting cells. What it will do, it will tell the bacteria, catch the bacteria and tell the lymphocyte, this is the person who has come from outside. Okay, how will you understand? So do we remember from our previous discussion about the desmosomes? Do we remember from our previous discussion about the desmosomes? We have taught you the desmosomes in the beginning of this, okay, but still we will let you write some points. So first let us have an orientation what we have learned. So in the abo layer, the first layer which we are seeing, that is the stratum corneum. What does the stratum corneum contain? It contains keratin fibers. Okay, this is stratum corneum. Then is the stratum lucidum. Then is the stratum that we said, palms and soles, isn't it? Palms and soles. We have stratum granulosum. Why granulosum, sir? They contain keratohyaline granules, keratohyaline granules. Okay, we are still in the epidermis, please. We are still in the epidermis. Then we said granulosum, then stratum spinosum. Stratum spinosum has, you know, they have some prickle type of an arrangement. Why? Because of desmosomes. Remember, they have some prickle type of arrangement in the spinous layer. Okay, and the spinosum, why spines? Because of the desmosomes, because of the desmosomes. Okay, and then we reach the dermis. Easy. So if a question is asked, why are these spine like? Because of desmosomes. Okay, second question will be asked in the MCQ, maybe, can you tell us the layer from which melanocyte is derived? It is neural crest cells. Neural crest cells produce melanocytes. Okay. Then I have to tell about Merkel cell also. So Merkel cell, M for Merkel, MS. MS means Masters in Surgery. Okay. So MS means Merkel cell and S is surface ectoderm. So Merkel cell is derived from surface ectoderm. And your skin is also derived from surface ectoderm, isn't it? The total surface ectoderm. Okay. So what receptors are present? What receptors you have in your skin? What receptors you have? So remember, do we remember project management? Okay, PMMR. Okay, or Mr. PM. You can remember like this. Mr. Prime Minister. Okay. Yeah. So Mr. Prime Minister. So M for Merkel cell or for Ruffini corpuscle. Ruffini corpuscle. P for Pacinian corpuscle. Pacinian. Okay. Pacinian corpuscle. Meissner. Meissner corpuscle. So what is the function of this Meissner corpuscle, by the way? 2-point discrimination. I will be teaching you in neurology. 2-point discrimination. Pacinian, P for Passy, P for pressure. So pressure, your sense of pressure, your vibration, that is sensed by Pacinian corpuscle. Ruffini. Ruffini actually checks the stretching of your dermis. Okay. Ruffini. Ruffini pinches. Ruffini pinches. Okay. Are we able to understand what I mean to say? So Merkel cell, Merkel, I told you, light touch. We just want a light touch of Merkel. Okay. Light touch of Merkel, stretch of Ruffini, Meissner 2, because SS. Can you see Meissner has 2S? How I remember? Let us show you. Meissner has 2S. That means it is 2-point discrimination. 2-point discrimination. Okay. Is it clear? Okay. There was a question asked, I think it was in PLab or somewhere in the question was which of the receptors is used by the blind people who are specially abled people, which of the following is used by the specially abled people in writing the braille, braille. So it's actually my Merkel. Okay, Merkel. So braille, Merkel. Okay, easy. So can we draw them on the diagram? All these receptors on the diagram? Yes, we should draw them on the diagram. So let us draw them like this. Let us bring it. Let us practice and visualize where they can be present. So let us write. So Mr. PM. Mr. PM. So let us begin. So first cell, Mr. M for Merkel. Okay, or you can take Meissner, it's your choice. So Merkel cell is present where? Yes, please contribute. Merkel cell is present where? Basal layer, isn't it? Basal layer. So where is the basal layer? So this is the basal layer. So Merkel. This is Merkel. This is how I remember. Then we go to melanocyte. Sir, melanocyte is also present here. So melanocyte, basal layer. Okay. Melanocyte. Easy. Isn't it easy? Melanocyte, Merkel. This is how we remember. Okay. And then where we go? Also, there is stem cell also. Why don't we write stem cells? Stem cells for making more layers. Stem cells. Okay. Then we take another color. So we said Langerhans cells. So Langerhans cells just go below the granular layer. So Langerhans cells. Langerhans. Let us draw them like macrophages. So need the full concentration about some lesions. Okay, just remember some lesions. Okay, if I talk about the macule, what is a macule? What is a macule? A macule is basically a flat lesion. First, you should write it is flat. It is not raised. It's flat. Okay, this is a flat, isn't it? There is no raised. It's flat lesion. Can you see, is it well demarcated? Is it well demarcated means is it merging? You can clearly outline it or not. So we can write it is well demarcated or well circumscribed. Well circumscribed. What is actually happening in this case in macule is only the skin color has changed. Can you see the skin color here and here? Isn't the skin color only changed? Okay, what is the length? 1 centimeter. So 1 or less than 1. If you have a lesion that is flat, that is well circumscribed, that is less than 1 centimeter, is a macule. Okay. What is a patch or papule? Let us write about papule. This is papule. What is a papule? Papule is when you have a skin lesion. If you tell me I should compare it so that it becomes easy for you to learn. So macule is less than 1 centimeter. What is greater than 1 centimeter? इसका opposite of this 1 centimeter patch. Patch is greater than 1 centimeter. Can you see? Patch is greater than 1 centimeter. But flat, same condition, just number is different. Like you have your mole, nevus, isn't it? Nevus, congenital nevus, or you call it a mole. So that is can be greater than 1 centimeter. What is a papule? It is shown. Papule is I write less than. So patch greater than 1 centimeter. Less than 1 centimeter is macule. Macule means less than 1. Okay. Patch means greater than 1. Now papule. Papule. Papule means it is elevated but less than 1 centimeter. Can we understand? Papule is elevated but less than 1 centimeter. See, elevated. This is the base. Can we see the elevation? So it is a papule. Okay, but less than 1 centimeter. Okay, now if this papule is having some fluid, if this papule is having some fluid, we call it, but less than 1 centimeter, we call it vesicle. We call it vesicle. Okay, we call it vesicle. So patch was greater than 1 centimeter. Macule was less than 1 centimeter. Raised or flat? Flat. This was also flat. Now talking about papule means you have to elevate. Papule. Okay, you have to elevate. But how much to elevate? Should be less than 1 centimeter. Should be less than 1 centimeter. If sir greater than 1 centimeter, name will get changed. Plaque, plaque, plaque. Okay. If sir it is having fluid inside, what will be the name? But less than 1 centimeter, what will be the name? It will be vesicle. It will be vesicle. If it is greater than 1 centimeter and having fluid and raised, it is bulla. This is what I was teaching you. The before disease, bulla. It is called bulla. Okay. I know you remember a name of a song also from this name. So bulla is greater than 1 centimeter. It is a fluid containing blister. Fluid containing blister. Next. Now, if you have a small fluid containing blister less than 1 centimeter, we are calling it a vesicle. If we have large vesicle more than 1 centimeter in raised and no in the place acquired by that lesion, so it is called what? Bulla. What? Bulla. If a vesicle, what is a vesicle? Please write first. What is a vesicle? What is a vesicle? What is a vesicle? No, yeah, 1 centimeter is, but you have to describe full fluid, very nice. Fluid filled less than 1 centimeter. So small, isn't it? It's a small. So now There is no size for something. Now if you want to remember pustule, pus means pustule means raised. So if you have a vesicle containing pus, we call it pustule. We call it pustule. Okay, we call it pustule. Okay, can you see the pustule? This is the pustule. Okay, now have you seen, once you have any allergy or something, you have whealing, or there is a no a light injury on the skin, that you are able to appreciate some whealing type of a thing, or something, no, it goes away with time. It goes away. Just for some period you have some whealing. Can you see this wheel? So this wheel, what is the definition of wheel? It is a smooth papule or plaque. Have you seen the allergy urticaria? Honeybee, beehive appearance. But they are not raised. They are something like a papule. No, they are papule, no, less than 1 centimeter elevation. But they can be greater than 1 centimeter also. So it is just transient. Okay, just for a small period of time. Then can we see the crust? Do we have a crust here? What is a crust? It's a dry exudate. Can we see the dry exudate? Things have come out here, some protein, some, this has been actually the arena of what? Arena of warfare, isn't it? Here was a war between the neutrophils and the bacteria or something like that. Okay, maybe that may be also present. So it's a dry exudate. So this is called crust. Now can you see the scaling happening? Can we see scaling? Where is the scale? Can you see the scaling happening in your tool sometimes? Scaling. That is actually what is removing, what you are removing, stratum corneum. Stratum corneum. Do we remember from the microbiology a disease called impetigo? Do we remember the impetigo? Who was causing impetigo, please? Who was causing impetigo? Impetigo is caused by what strep? Strep pyogenes. That's a beautiful answer. Now, do you remember the association? What can cause urticaria allergic reaction? What can cause urticaria allergic reaction? Okay. Can you tell me how much is the length of your mole? If you have a mole, that is called nevus. Or if they are, in plural, so we say nevi. So what is the nevus? Your mole that is elevated also, and it is less than 1 centimeter. Okay. But have you seen some people, they have a congenital birthmark, a big birthmark. Some big birthmarks you have. So that is a patch. That's a patch. Okay. Sometimes that angel's kiss, I think you have read in, that's actually in pediatrics. So angel's kiss is seen on the baby. So I hope you have enjoyed this lecture, and I want to tell you some, in the end, I want to give you some terms. So I want to tell you some terms about keratosis. Okay. So we have dyskeratosis, we have acanthosis, we have acantholysis, we have hyperkeratosis, we have parakeratosis. If we talk about dyskeratosis, if someone has early keratinization, means premature. We remember keratinization or not from the previous lecture? Do we remember the keratinization from previous lecture? Okay, so early keratinization is called dyskeratosis. Okay, now if I have increase in the spinosome layer, if I have increase in the spinosome layer, that is called acanthosis. It is seen in which disease? Psoriasis. So acanthosis, spinosome layer is more hyperplastic. Hyperplasia means increase in the number of cells. Hyperplasia. So if there is increase in the number of cells of acanthosis, we call it this spinosome cells, we call it acanthosis. What is acantholysis? When you are separating the epidermal cells, like in the pemphigus vulgaris, isn't it? So that is acantholysis. Okay. Hyperkeratosis, hyper means more, keratosis means corneum. So increase in the thickness of stratum corneum. Increase in the thickness of stratum corneum also happens in psoriasis. Parakeratosis means when you have, do we have nuclei in the stratum corneum? Do we have nuclei in the stratum corneum? Do we have nuclei in the stratum? No. Yeah. So normally we don't have. Normally we don't have. But in the condition like psoriasis, what we see in the psoriasis, we are able to see there is retention. There is nuclear retention in the corneum layer. So stratum corneum has nuclear retention. So parakeratosis. So dyskeratosis, premature keratinization. Acanthosis, increase in the spinosome layer seen in psoriasis. Hyperkeratosis, increase in the thickness of stratum corneum, psoriasis. Parakeratosis, nucleus retained, psoriasis. Um, Acantholysis, epidermolysis are separated, pemphigus vulgaris. I hope you have enjoyed it. If you have not subscribed to my channel, please subscribe, and I will be making videos on all the 19 subjects of MBBS live classroom. All other people can join my live classroom on the Zoom meeting. Thank you and enjoy MBBS. God bless you and see you tomorrow. Bye bye.